one of the biggest concepts in stroke pharmacotherapy is that time is brain. Trying to understand a treatment for a neurological disease such as stroke really involves two major factors. It involves understanding whether the drug will work in the brain, but also it's critically important to understand the mechanisms that allow that drug to get to the brain in the first place. Statins were developed as a means of trying to control cholesterol. However, in stroke patients, because one of the risk factors, of course, being obesity and dyslipidemias, patients who either have their first stroke or are a higher risk factor for stroke are already on a statin. And what's been noted is that in patients who are on a statin, as compared to those who aren't, their outcomes post-stroke, if they have their first stroke, are far better. And in patients who have already had a stroke and then you put them on a statin, the risk of having a recurrent stroke is greatly reduced. So this led to the hypothesis that statins may very well have beneficial effects in the brain following stroke. Statins are absolutely fascinating molecules because they don't just act in the liver, but they have many other targets that they could potentially work on in the brain. These include such things as being able to reduce inflammation in the brain, which is a common problem that happens in the brain post-stroke, as well as reducing oxidative stress, which is also well known to cause further injury to nerve cells in the brain following a stroke as well. One of the biggest issues that we work on in my lab is trying to understand how to successfully deliver drugs such as statins to the brain post-stroke. Historically, brain diseases have been very difficult to treat because of the blood-brain barrier. We've been working on a series of transporters known as organic anion transporting polypeptides, or OATPs, as a vehicle for getting statins across the blood-brain barrier in stroke. By harnessing the biology of the blood-brain barrier, this really would be a twofold advantage. First of all, it would allow us to efficiently get drugs into the brain at effective concentrations. And the second thing is this would allow us to modify the formulation for statins. Statins are only formulated for oral delivery, meaning that they're only available in tablet form and can only be taken by people who can swallow. One of the biggest problems in stroke patients is that in the 24 hours immediately following a stroke, there's about 50% of patients who can't swallow and therefore are unable to take an oral medication. By understanding the mechanisms that would deliver statins in the immediate hours and days post-stroke, and also by being able to formulate a statin into an intravenous formulation, this would give us the ability to give these drugs to people very early in the course of stroke, and therefore they'd be able to get neuroprotective benefits earlier.